Bismillahirrahmanirrahim. Rabbi shrah li sadri wa yassir li amri wahlul uqdatan min lisani yafqahu qawli. My Lord, open my heart and make my task easy for me. Loosen the knot in my tongue so that they may understand my speech. I am Dr. Hambacha, PhD Diagnostic Ultrasound Associate Professor and CEO of SAMS Diagnostic Ultrasound. We have already discussed about different imaging modalities. Now a question arises, is ultrasound better than other imaging modalities? So for that reason, you will have to prove, justify ultrasound is better than other imaging modalities. So first of all, a few imaging modalities which are in use include ultrasound, X-ray, plain X-ray, computed tomography, magnetic resonance imaging, nuclear medicine, positron emission tomography scan, PET scan. By comparing them, we came to the conclusion that ultrasound is better than other imaging modalities in many clinical situations due to its safety, accessibility, affordability, portability, and real-time imaging capability. If we compare ultrasound with these imaging modalities, we'll be seeing that X-ray is based on X-ray photon, and according to the wave particle duality theorem, X-ray photon acts like a wave as well as a particle, and just like a particulate matter that pass through the body and make a silhouette on an X-ray film placed on the opposite side of the body, based on the attenuation of X-rays due to density of different structures. The same way, X radiation is used in computer tomography and fluoroscopy, but in the case of magnetic resonance imaging, magnetism is used in MRI, but still some contrast related, some claustrophobic and bioeffects are over there. And apart from that, magnetic resonance imaging is contraindicated for those individuals having some implants, metallic implants inside the body, any pacemaker, etc. Then nuclear medicine, just like positron emission tomography, and the radionuclides are introduced inside the body. So again, this is a slightly invasive procedure. And then the radioactive isotopes are introduced inside the body. So most probably there will be some bioeffects related to that as well. But unlike all these modalities, ultrasound is based on sound waves. Sound waves are generated by the ultrasound transducer that can introduce inside the body, and we will discuss it shortly. So if we are going to compare ultrasound with the other imaging modalities, so first of all, we should know about the ultrasound. So it is a diagnostic imaging technique that uses high frequency sound waves to produce image of the body structure or any pathological changes that can occur in the anatomic structure. So if there is any morphologic changes, that could be detected with the help of imaging modalities. So if there is no morphologic changes, a number of different diseases can exist, but they are not going to create any morphologic changes. So that's why that couldn't be detected with the help of medical imaging modalities, all imaging modalities, not only ultrasound. The basic principles of ultrasound is that ultrasound transducer is mounted with piezoelectric crystal. For example, if I draw a transducer over here, so just imagine this is a transducer. So multiple crystals are mounted in front of the transducer. And these are piezoelectric crystals. They are supplied with electric voltage. In response to that electric voltage, they are going to generate sound waves, and these sound waves propagate in the medium. That medium could be the human body, any fluid filled structure, or anything in which sound wave can propagate ultrasound, right? So when once the ultrasound waves are propagated in the medium, they can reflect back from different reflector placed at different location. Once they are received back by the same crystal, which has already generated these sound waves, they will calculate the ergo return time. So if any structure which is placed near to a transducer, it will have the sound waves reflecting back from that reflector will have a short go return time, while any structure which is placed deep in the body in the medium, that structure, the reflected sound waves will have greater go return time, and according to that go return time, different reflector are placed at different location, right? Because once the echo are received by the transducer, the machine don't know anything about the structure or whatever that may be, either the human body or not, but according to the go return time, its location is placed, and the location of every structure is placed inside the body. And once these all echoes are received by the body, then it's reconstructed, its image is created, and you came to the conclusion that this is an image of the lever made by the ultrasound machine, right? So, according to go return time, for example, some of the echoes are taking larger go return time because they are coming back from structure they are placed deep in the body, distal to the transducer, and some of the echoes are coming back very soon because they are placed near to a transducer. So, according to that go return time, their location is placed, and based on their echo amplitude, if the reflector is strong enough, for example, this is a reflector, and just assume that it is strong reflector, so the echo reflected from it will have high amplitude, and they will mark a very bright dot over here. And if there is any reflector which is weak reflector, so echo will be reflected with low amplitude, and that will mark a dark dot on the ultrasound image. In this way, the ultrasound image will form from black to white and different gray shades. That's why image is also called grayscale image. Color Doppler is something else that can detect the movement of the reflector and direction of the reflector, but that actually doesn't give any color to the actual color to the body structure, right? But that shows the movement of the reflector in the form of colors. That's why that is called color Doppler. But that color will not be the actual color of the body structure. Then once the echoes are reflected back by the reflector, they are received by the crystal, and initially the electric voltage was converted to mechanical energy, means sound energy, and then the echo reflected back towards the transducer. Now that same crystal is now converting the mechanical energy into electric signal, and that electric signal is directed towards the receiver. The receiver then process the echo signal, enhance it, and amplify it, and then place it in the memory. And once the entire image is formed in the memory, that is directed towards the display. So reflection of sound waves from different tissue structure is required for the formation of the ultrasound image, and this way real-time ultrasound image is formed while structure is moving inside the body, and that movement could also be detected on the display. So the components which are there in an ultrasound machine are transducer, which is acting to convert electrical energy into sound energy and back sound echo into electrical energy. And then the processing unit containing the pulsar, the receiver, memory, and so on. And then once the image is formed in the memory, that is directed towards the display monitor, which is a friendly user interface, and decipher the deciphered information or the hidden information in the echo that will be readable by the observer. Then major advantages of the ultrasound. Why ultrasound is superior to the rest of imaging modalities? Because there is no ionizing radiation. Most of the imaging modalities are based on ionizing radiation, just like plain X-ray, fluoroscopy, CT scan, etc. But here in the case of ultrasound, only sound waves are used over here, and ultrasound is introduced in health delivery system from World War till now. A number of experiments have been done by the bioeffects or the adverse effects of the medical diagnostic ultrasound, but no single experiment have proved that there is any bioeffects of the medical diagnostic ultrasound. Then it is real-time imaging of the structure is moving inside the body that could be appreciated on the display. For example, heart is moving up and down during systole and diastole, and that movement could be seen in real time on the display. Then ultrasound is portable, and bedside sonography is possible with the help of ultrasound, because and the latest technology, ultrasound and the ultrasound, different gadgets have been created or made by the engineers, and now ultrasound is very easy to be comfortably taken to the bedside up near to the patient, and ultrasound could be performed in the patient bed at in the ward or in the operation theater or even in the residence of the patient as well. Ultrasound is cost effective. It is relatively cost effective if we compare it with the rest of imaging modalities, and it's widely available and readily available everywhere. The availability of ultrasound is possible even in the basic health unit of the rural areas. Ultrasound is also available. Then it is safe in pregnancy, and that is the main reason. For that reason, we can use ultrasound in pregnancy for the once the menses are missed, and the patient is expecting for the pregnancy, and the pregnancy test has been done, then patient is advised ultrasound for the detection of pregnancy, for the viability of pregnancy, for the dating of pregnancy, for the growth of the baby, for the fetal well-being, and for different purposes, even in certain condition. The gender detection is also required for some medical reasons, so that could also be seen with the help of ultrasound. The body structure, the anatomy of the fetus, and fetal biophysical profile, the placental localization, the cervical length measurement, the os opening, and so on. And then for the mood of the delivery, that could also be seen with the help of ultrasound or assessed with the help of ultrasound. It's soft tissue resolution is excellent, right? While using high frequency transducer, we will have high spatial resolution, particularly axial resolution. For example, we are using high 14 megahertz frequency, then the axial resolution of ultrasound becomes better than MRI. I'm not talking about contrast resolution, only the axial resolution. Then Doppler vascular assessment. So if we use the Doppler, so with the help of Doppler, we can detect moment of either it is the moment of any body structure or blood, but mostly it is used for the movement of the blood. And then not only the movement of the blood, but the direction of the blood or the direction of the movement and detailed characteristics of the movement. movement. For example, blood is rhythmically contracted by the heart in the blood vessels, so it can have a number of characteristics: their pulsatility, resistance, systolic to diastolic ratio, acceleration with each cardiac contraction could be assessed with the help of Doppler. And with the help of that Doppler, we can predict a number of different pathological conditions from these Doppler indices. Then dynamic evaluation is possible in ultrasound, and in the case of any moment, any structure which we are intended to see it in the moment, that is also possible to be seen. For example, we want to see the supraspinatus tendon in abduction and adduction, so that could easily be appreciated with the help of ultrasound. And the same way in external internal rotation, we can see the long head of bicep tendon, subscapular tendon. Similarly, the patellar tendon, if we are intended to see its movement, its anatomic changes during movement, that could also be assessed. In the abdomen, rectus abdominis muscle, internal oblique, external oblique, transverse abdominis muscle, and so on. They can also be assessed with the help of ultrasound in its dynamicity, in its movement, and different postures. And apart from that, if there is any pathological condition, particularly in the physical therapy, if there is any tear in the tendon, and the physical therapist is going to treat it with the help of some laser therapy, etc. So the effectiveness of the treatment could also be assessed with the help of ultrasound because it is safe. There is no radiation related hazard. So first of all, it is radiation free. So unlike CT scan, X-ray, fluoroscopy, ultrasound doesn't use ionizing radiation. And you know about the ionizing radiation that could cause a number of different bioeffects, but ultrasound is safe from all those bioeffects which are related to X radiation because it uses ultrasound, not X radiation. Then its importance, so it's safe in pregnant women. So we have all discussed about the pregnancy, that it's safe for the children, suitable for the repeat follow-up scan, or if there is any intended screening of the patient in high-risk individual, but we can't use X radiation without any pathology. No cumulative radiation risk. And while comparing with CT, CT is high radiation exposure, X-ray moderate radiation exposure, but ultrasound has no radiation exposure. That's why ultrasound is better than radiation-based imaging modalities. Then it's real time capability is there, so dynamic assessment is possible in ultrasound, and we can see moving structure in its dynamicity or in its movement, and if there is any morphologic changes occurring due to movement, that can also be detected with the help of ultrasound. Then fetal movement can be detected, cardiac motion can be detected in echocardiography during systole and diastole, the annular plane excursion, whether it is mitral annular plane excursion, the tricuspid annular plane excursion, that could be detected with the help of ultrasound and tissue Doppler imaging. Tendon movements. If we are interested in the movement of a tendon. For example, there is any partial tear in the tendon, but it's impossible to be observed during static condition. Then we can move the structure, and will become able to see that partial tear. If there is any hairline fracture in the rib or any other bone, and that is missed by CT scan, MRI. I have seen a lot of such fractures, hairline fracture, that are missed by CT scan, MRI, X radiation, but I have seen on ultrasound. For example, one of the patient suffering from a sternal fracture. There was a fracture in the sternum, but that was missed by other imaging modalities. But the help of ultrasound we can see, because the patient can show you the pinpoint location of the pen, and if you meticulously evaluate that particular region, then you will be able, because with the help of ultrasound you can magnify structure. So if you magnify it, you give a little bit graded compression. So with the help of that graded compression, that particular region can have some moment, and that moment can differentiate fracture from intact bone. Then vascular blood flow can be detected if there is any mass in any part of the body, whether it is in tendon or muscle or anything else. We can apply color Doppler on it, and we can see the blood flow perfusion of the organ as well as the pathological structure or the morphologic changes. Organ mobility can also be detected with the help of ultrasound, and its advantages over CT and MRI are that it's mainly provides CT and MRI mainly provide static image, but ultrasound can evaluate structure and dynamicity. Its portability and bedside use is also its benefit advantage over the other imaging modality, because point of care ultrasound is possible but in emergency room, in ICU, operation theater, ambulance, rural healthcare centers, disaster area. So that is actually the benefit of ultrasound. Immediate diagnosis without response critically help without transporting critically ill patient, right? Then it's cost effective relatively as compared to other imaging modalities. So it's economical. Ultrasound is significantly cost effective, not cheaper. It's written over here cheaper. Ultrasound is not that much cheaper, as because the word cheaper by itself is cheap. So ultrasound is cost effective. Relatively, its charges are less than the other imaging modality, for example, CT scan, MRI, and MRI and CT scan are time consuming. In terms of CT scan, MRI, patient is advised to wait for their turn. Sometimes in some busy centers, patient is given their turn after months or more than that. Financial advantage, so lower machine cost, lower maintenance cost, affordable for patient, reduced healthcare burden, and global impact, ideal for developing countries like us and low resource settings. If there is any setting which is low resource, so ultrasound is better for those settings as well. Then excellent soft tissue imaging. If we use high resolution, high frequency sound waves, so the ultrasound is in the superficial soft tissue, ultrasound is highly effective for the evaluation of thyroid, breast, muscles, tendons, testicles, penile tissues, parotid gland, submandibular gland, sublingual gland, and so on. Superficial masses, lymph nodes, if there is any abscess, lipoma, or any other lesion which is in the superficial tissues, that can bitterly be evaluated with the help of ultrasound. An additional benefit, if you use high frequency transducer, for example, as we have already mentioned, that if you use 14 megahertz transducer, then its axial resolution will be better than even MRI. Doppler ultrasound advantages, so vascular assessment. Doppler ultrasound evaluate blood flow direction, velocity, vascular resistance, vessel patency, and clinical application. Carotid Doppler, deep and thrombosis assessment, renal Doppler, obstetric Doppler. In the obstetrical ultrasound, we can evaluate umbilical artery, middle cerebral artery, ductus venosus, blood flow to the placenta, uterine arteries, and so on. They can be evaluated with the help of Doppler. Peripheral arterial diseases can be assessed with Doppler. And unique features of ultrasound are real-time hemodynamic evaluation without contrast. So in the rest of other imaging modality, for example, in the CT angio or MR angio, contrast medium is injected. So some of the radiation-related hazards could be faced by the patient. But apart from that, contrast media-related hazards and side effects could also be experienced by the patient. Ultrasound in obstetric and gynecology, so it's gold standard in pregnancy because ultrasound is totally safe, and obstetric and gynecology is essential, and pregnancy confirmation, fetal growth assessment, congenital anomaly scan, placental localization, fetal development, fetal Doppler studies, fetal development studies, anatomy scan, and could also be used to look for the mode of delivery, whether the fetus is breechly capelically presented, or its presentation is also important in terms of its mode of delivery. Then placental localization, whether it is placenta previa, accreta, increta, percreta. So all these could be evaluated with the help of ultrasound. So why is ultrasound better than MRI and CT are not routinely performed during pregnancy? Because they have some sort of hazards. CT is radiation based and MRI is costly. Apart from that, if there is any cardiac pacemaker or any metallic implant in the patient, so the MRI is contraindicated in those individuals. Mm. Ultrasound in emergency department, so focus assessment with sonography and trauma fast, and fast emergency focus assessment with sonography and trauma are used to detect hemoperitoneum, pericardial effusion, pneumothorax, internal bleeding, and blunt torso trauma. And the key benefit of ultrasound, rapid bedside diagnosis and life-threatening situation is possible with the help of ultrasound. Ultrasound is also very useful in the guided procedures. So interventional procedure could be performed in real time with the help of ultrasound. You can see the approach of the needle or the core biopsy structure to proceed in the body, and you can avoid any structure, for example any nerve, any artery, any structure that should be avoided. So in real time you can easily avoid those structure. Then ultrasound is used in biopsy, aspiration, drainage procedures, central venous catheter replacement, joint injection, nerve block. Nowadays nerve block is used in most of the surgeries. So if nerve block is done under ultrasound guidance as compared to blind injection, so that will be far more better and more productive. Then advantages, improve safety and procedural accuracy, because if you are going to take any specimen from a target and you have performed that procedure under ultrasound guidance, so that will be far more better and more accurate, more than 95% accurate as compared to blind procedure. Particularly, our topic is about musculoskeletal ultrasound, and in the case of musculoskeletal ultrasound, dynamic examination is at most important because ultrasound is highly useful for the tendon tear, the ligament injury, joint effusion, muscle injuries, sports medicine, and its unique strength is dynamic movement examination during scanning. So, in some of the conditions, Musculoskeletal ultrasound is the modality of choice due to its dynamic evaluation. For example, in the cases of the shoulder impairment syndrome, that could only be seen with dynamic ultrasound, or the subluxation or dislocation of the long head of bicep tendon can only be assessed with the help of ultrasound, but the rest of all other imaging modalities couldn't be used for it. Then comparison with CT scan, ultrasound versus CT. So ultrasound advantages: no radiation, portable, real-time imaging, low cost, safe for pregnancy. And the CT advantages: better for bone and lung evaluation. But as we have already discussed, that in some of the hairline fracture, we can prefer ultrasound as compared to other imaging modalities because due to pinpoint location and uh, and apart from that, with the help of provocative mirror with graded compression, we can differentiate intact bone from the fracture bone. Faster whole body trauma can be assessed only with CT scan, but that is impossible or very difficult with ultrasound. In conclusion, ultrasound is preferred for many soft tissue and vascular condition, but its limitation is that intra-articular structure couldn't be evaluated with the help of ultrasound. Then if we compare it with MRI, so ultrasound is a faster examination, more accessible, less expensive, portable dynamic imaging, better tolerated by the tolerated by the claustrophobic patients. MRI advantages are superior deep tissue, soft tissue contrast, brain and spinal imaging. In conclusion, ultrasound is often the first line modality, but in some of the condition, ultrasound is the modality of choice, and the ultrasound can be it is gold standard. As we have already discussed, the structure which could only be seen in dynamic evaluation. So for that reason, ultrasound is the modality of choice for those individuals or those pathologies. Then artificial intelligence and modern ultrasound. So and the future of ultrasound, modern ultrasound system include AI assisted measurements, automated calculation, elastography, contrast enhanced ultrasound, 3D 4D imaging, and portable handheld devices. And apart from that, speckle tracking imaging, vector flow imaging, these are the advances of ultrasound with the help of which AI can be further assisted to detect the direction of blood flow, to detect the movement of any structure, for example, and the contraction relaxation of the heart. It undergoes a complex movement. The cardiac muscle undergoes complex movements that can only be detected by the speckle tracking imaging. So, in result, ultrasound continue to evolve rapidly. Limitations of ultrasound. So, although highly valuable, ultrasound has some limitations. The first limitation is operator dependency. But to overcome this limitation, such programs and talks are needed to enhance increase the operator knowledge to overcome this limitation, right? Then difficulty imaging through bone and gas. So bone and gas are poison for ultrasound. So whenever there is any gas or bone, so behind it we will not be able to evaluate any structure. But for example, if there is any stone in the urethra and the gas filled gut loops overlying the urethra, so it will become difficult for the urethra to be evaluated. But with the grace of Almighty Allah, I have 13 years of experience in ultrasound, and till now I haven't advised anyone, any patient, any single patient, CT or MRI for the evaluation of any ureteric stone, because it needs some time, but you will be able to apply some provocative mirror and localize the ureteric stone, and you can avoid the unwanted radiation dose of the patient. Limited penetration in obese patient, because ultrasound waves, if you use high frequency sound waves, then it will become difficult to reach to a distal structure. It become a limitation. A smaller field of view as compared to computer tomography and MRI, because the field of view ultrasound is small enough, so sometimes if you elevate any tendon in the wrist joint, that could be difficult to differentiate from the ankle joint because of its limited field of view. And despite limitation, benefit of an overweight disadvantages of ultrasound. So the benefits of ultrasound are overweighted with its disadvantage. That's why we can say that ultrasound is better than other imaging modalities, because it is safe, radiation free, affordable, accessible, portable, dynamic, real time, versatile, patient friendly, and its clinical reality. Ultrasound is the first line imaging modality in many medical specialties, and in some of the pathological condition, ultrasound is the modality of choice, and it is a gold standard. And particularly in the pathologies, can only be evaluated in dynamicity. So ultrasound is not merely an alternative imaging modality in many clinical situations. It is the safest, fastest, more accessible, and most practical dynamic tool. So it was all about the statement that ultrasound is better than other imaging modalities. If you have any question, then you can ask, you can write in the comments, you can message me. Once again, I'll tell you that I'm Dr. Hambacha from SUMS Diagnostic Ultrasound, and thank you once again.